Assalamu alaikum. I hope so you're doing fine. I'm Dr. Muhammad Ali Rabani and I'll be discussing the nerves that are on the dorsal aspect of the foot. Keep in mind the cutaneous nerves are discussed elsewhere in the overview of the dorsal nerve on the dorsal aspect. Here I'll be talking about the deep nerve, that is the deep peroneal nerve, uh, the branch of the common peroneal nerve. So it is a nerve that is discussed in the anterior compartment too, continues forward, comes here. It does not change its name as opposed to the artery. Throughout its length, it is related lateral to the artery. So the nerve is lateral and the artery is medial. And the origin will be lying in the leg compartment, in the lateral compartment where there is a bifurcation of common peroneal. The root or in the leg is discussed elsewhere in the lecture. In this layer, you just have to say that it enters the foot when passing between the two malleoli, passes on the lateral aspect of artery, and where the arcuate artery branch is given at that point, it divides into the lateral and the medial branch. The lateral branch goes on to supply the extensor deuterum brevis and extensor hallucis brevis, and the lateral branch continues with the continuation of the dorsalis pedis artery all the way to the first cleft, where it supplies the skin adjacent between the two toes, and by supplying it, it terminates. That's it. That you have to know for the deep peroneal nerve, and that is the cleft that will be insensitive or that will have altered sensation in case of anterior compartment syndrome. The relationship to the tendons will be the same. On the anterior aspect, you will have extensor retinaculum inferior. On the anterior aspect, you will have extensor hallucis longus tendon. On the posterior aspect, you will have these tendon, these bones, the talus bone, the navicular bone, the cuneiform, the medial and intermediate cuneiform bones, and the basis of the metatarsals. And on the medial aspect, you will have the extensor hallucis longus tendon. On the lateral aspect, again, in addition, medially you will have this artery, and the lateral aspect you will have extensor digitorum longus superiorly and extensor hallucis brevis inferiorly. That's it. Thank you so much, and for any question and suggestion, please mention in the comments below, and follow us for our other videos on the lateral compartment of leg, on the posterior compartment of leg, and so on. Thank you.